Hello guys and welcome back to my channel. In this video we will be learning about the thyroid gland. To begin with, the thyroid gland is an endocrine gland with rich blood supply situated in the lower part of the front and the sides of the neck. It regulates the basal metabolic rate, stimulates somatic and psychic growth and plays an important role in calcium metabolism. The gland consists of right and left lobes that are joined to each other by an isthmus. A third lobe, that is a pyramidal lobe that you see right here, may project upwards from the isthmus. Now looking at the situation and extent of the thyroid gland, the gland lies against the C5 to T1 vertebrae, embracing the upper part of the trachea. Each lobe extends from the middle of the thyroid cartilage. As you can see right here, this is the thyroid cartilage, and each lobe extends from the middle of the thyroid cartilage to the fourth or fifth tracheal ring, as you can see right here. The isthmus, that is the area right here, extends from the second to the fourth tracheal ring. Looking at the dimensions and weight of the thyroid gland, each lobe, that is the right and the left lobe, measures about 5 cm in length to 2.5 cm in breadth and 2.5 cm in thickness, and the isthmus is 1.2 cm into 1.2 cm. On an average, the gland weighs about 25 grams. It is larger in females than in males. Further increase in size takes place during menstruation and pregnancy. Moving on to the capsules of the thyroid gland, we have two capsules. One is the true capsule that you see right here, and the second is the false capsule that you see outside. The true capsule right here is a peripheral condensation of the connective tissues of the gland. A dense capillary plexus is present deep to the true capsule. To avoid hemorrhage, that is loss of a lot of blood during operations, the thyroid is removed along with the true capsule. The false capsule that you see right here as the outer layer is derived from the pretracheal layer of the deep cervical fascia. Now this is a diagram from the posterior aspect. This is the esophagus, the trachea and the thyroid gland along with the blood vessels supplying it. The false capsule that we were talking about is thin along the posterior border of the lobes. This is the left lobe, that is the right lobe, and this is the posterior border. So it is thin along the posterior border of the lobes but thick on the inner surface of the gland, where it forms a suspensory ligament that you see right here, which is called the Berry's ligament or the suspensory ligament of Berry, which connects the lobe to the cricoid cartilage present right here. This is the suspensory ligament of Berry. This is the cricoid cartilage to which the suspensory ligament of Berry attaches to. Now concising the important points in detail, the thyroid gland is an endocrine gland with rich blood supply situated in the lower part of the front and the sides of the neck. It regulates the basal metabolic rate, stimulates somatic and psychic growth and plays an important role in calcium metabolism. The gland consists of right and left lobes that are joined to each other by the isthmus. A third pyramidal lobe may be project upwards from the isthmus. Now, the situation and extent. The gland lies against the vertebrae C5 to C7 and T1, embracing the upper part of the trachea. Each lobe extends from the middle of the thyroid cartilage to the fourth or fifth tracheal ring, and the isthmus extends from the second to the fourth tracheal ring. Looking at the dimensions and width, each lobe measures about 5 into 2.5 into 2.5 centimeters and the isthmus 1.2 into 1.2 centimeters. On an average, the gland weighs about 25 grams. It is larger in females than in males, and further increase in size during menstruation and pregnancy takes place. Moving on to the capsules, there is a true capsule and the false capsule. The true capsule is the peripheral condensation of the connective tissues of the gland. A dense capillary plexus is present deep to the true capsule. To avoid hemorrhage during operations, the thyroid is removed along with the true capsule. Moving on to the false capsule, it is derived from the pretracheal layer of the deep cervical fascia. It is thin along the posterior border of the lobes but thick on the inner surface of the gland, where it forms a suspensory ligament of Berry which connects the lobe to the cricoid cartilage. Moving on to the parts and relations of the thyroid gland, each lobe, that is the right and the left lobes, have an apex right here, a base, three surfaces, that is lateral, medial and posterolateral, which I will be explaining later, and two borders, anterior and posterior border. So, the lobes are conical in shape. They have an apex, a base, three surfaces, that is lateral, medial and posterolateral, and finally two borders, that is anterior and posterior borders. Now, let us learn about it in detail. The apex of the thyroid gland is directed upwards and slightly laterally, that is away from the median plane. It is limited superiorly by the attachment of the sternothyroid muscle right here to the oblique line of the thyroid cartilage that you can see right here, which is medial to the apex. This is the thyroid cartilage. This is the attachment of the sternothyroid muscle, and the apex is limited superiorly by the attachment of this muscle. The similar thing can be seen clearly on the other lobe. This is the sternothyroid muscle. This is the apex of the thyroid gland. The apex is related to the superior thyroid artery, as you can see right here. These are the superior thyroid arteries. The apex of the thyroid gland is also related to the external laryngeal nerve, which is a branch of the superior laryngeal nerve. After the apex, now moving on to the base is at the level with the fourth or the fifth tracheal ring. It is related to the inferior thyroid artery, as you can see right here. The base of the lobes are also related to the recurrent laryngeal nerves, as you can see right here. This is a transverse section through the anterior part of the neck, and this is the thyroid gland, this is the trachea, and this is the esophagus. Now, we are going to learn about the three surfaces, that is the lateral, medial and posterolateral surface of the lobes. This is the lateral surface. This is the medial surface, that is towards the median plane, and this is the posterolateral surface because it comes to the posterior and lateral side. So, this is the posterolateral surface. Again, this is the lateral surface, this is the medial surface, and this is the posterolateral surface of the lobes of the thyroid gland. Looking at the lateral surface or the superficial surface, it is convex, as you can see, and is covered by the sternohyoid muscle, the superior belly of the omohyoid muscle, the sternothyroid muscle, and the sternocleidomastoid muscle. Similar structures can be seen in relation to the lateral surface of the lobe of the thyroid gland on the opposite side. Nextly, looking at the medial surface, it is related to the two tubes, that is trachea and the esophagus, two muscles, that is the inferior constrictor and the cricothyroid, which cannot be seen in this diagram, and two nerves, that is the external laryngeal and the recurrent laryngeal that I have shown you earlier. This is the inferior constrictor and this is the cricothyroid muscle. Moving on to the third surface, right here, that is the posterolateral or the posterior surface. It is related to the carotid sheath that you see right here as well as here, and it overlaps the common carotid artery. Moving on to the borders, we have two borders, that is the anterior border and the posterior border. The anterior border is thin and is related to the anterior branch of the superior thyroid artery, as you can see right here. Same on the other side. This is the superior thyroid artery, the anterior branch. This is the anterior border, and this is the anterior border. Moving on to the posterior view, the posterior border of the thyroid gland right here is thick and rounded and separates the medial and the posterior surfaces. It is related to the inferior thyroid artery, as you can see right here. It is related to an anastomosis between the posterior branches of the superior and ascending branches of the inferior thyroid artery. It is related to the parathyroid glands, which cannot be seen in this diagram, and the thoracic duct only on the left side. Now, looking at the features of the isthmus connects the lower parts of the two lobes, as you can see right here. It has two surfaces, that is the anterior and the posterior surface behind. It has two borders, the superior border and the inferior border. Now, looking at the anterior surface is covered by the right and the left sternothyroid and the sternohyoid muscles on both the sides. It is also related to the anterior jugular veins and fascia and skin. The posterior surface of the isthmus is related to the 2nd to 4th tracheal rings. The superior border is related to the anterior branches of the superior thyroid artery of both right and left sides, as you can see right here and right here. This is the left lateral view of the neck. This is the thyroid gland. This is the inferior border of the thyroid gland. So, it is related to the inferior thyroid veins, as you can see right here, which leave the gland at this border. Now, concising the important points in detail, looking at the parts and relations, the lobes are conical in shape, having an apex, a base, 3 surfaces, that is lateral, medial and posterolateral surface, and 2 borders, anterior and posterior border. The apex is directed upwards and slightly laterally. It is limited superiorly by the attachment of the sternothyroid muscle to the oblique line of the thyroid cartilage, which is medial to the apex. The apex is related to the superior thyroid artery and external laryngeal nerve. The base is at the level with the 4th or 5th tracheal ring. It is related to the inferior thyroid artery and recurrent laryngeal nerve. The lateral surface of the superficial surface is convex and is covered by the sternohyoid muscle, the superior belly of the omohyoid, the sternothyroid and the anterior border of the sternocleidomastoid muscle. The medial surface is related to 2 tubes, that is the trachea and the esophagus, 2 muscles, that is the inferior constrictor and the cricothyroid, 2 nerves, that is the external laryngeal and recurrent laryngeal nerve. The posterolateral or the posterior surface is related to the carotid sheath and overlaps the common carotid artery. The anterior border is thin and related to the anterior branch of the superior thyroid artery. The posterior border is thick and rounded and separates the medial and posterior surfaces. It is related to the inferior thyroid artery, anastomosis between the posterior branch of the superior and ascending branch of the inferior thyroid arteries, the parathyroid glands and the thoracic duct only on the left side. The isthmus is a structure that connects the lower part of the 2 lobes. It has 2 surfaces, that is anterior and posterior, and 2 borders, that is superior and inferior. The anterior surface is covered by the right and left sternothyroid and sternohyoid muscles, the anterior jugular veins and fascia and skin. The posterior surface is related to the 2nd to 4th tracheal rings. The upper border is related to the anterior branches of the right and left superior thyroid arteries, and finally the lower border of the isthmus is related to the inferior thyroid veins that leave the gland at this border. Moving on to the arterial supply of the thyroid gland, it is supplied by 2 arteries, that is the superior and the inferior thyroid arteries. First, let us look at the superior thyroid artery right here. The superior thyroid artery is the first anterior branch of the external carotid artery that you see right here. It runs downwards and forwards, and after giving branches, it pierces the pretracheal fascia to reach the apex of the lobe, where it deviates medially. At the upper pole, the artery divides into anterior and posterior branches. This is the anterior branch. Similarly, on this side, this is the anterior branch. The anterior branch descends on the anterior border of the lobe and continues along the upper border of the isthmus right here to anastomose with its fellow of the opposite side. Moving on to the inferior thyroid artery that you see right here. It is a branch of the thyrocervical trunk which arises from the subclavian artery. It runs first upwards, then medially and then finally downwards to reach the base of the gland, the thyroid gland. The artery then divides into 4 to 5 glandular branches which pierce the fascia separately to reach the lower part of the gland. Concising the important points under the arterial supply, the thyroid gland is supplied by the superior and inferior thyroid arteries. The superior thyroid artery is the first anterior branch of the external carotid artery. It runs downwards and forwards, and after giving branches, it pierces the pretracheal fascia to reach the apex of the lobe. At the upper pole, the artery divides into anterior and posterior branches. The anterior branch descends on the anterior border of the lobe and continues along the upper border of the isthmus to anastomose with its fellow on the opposite side. The posterior branch descends on the posterior border of the lobe and anastomoses with the ascending branch of inferior thyroid artery. The inferior thyroid artery is a branch of the thyrocervical trunk which arises from the subclavian artery. It runs first upwards, then medially and finally downwards to reach the base of the gland. The artery divides into 4 to 5 glandular branches which pierce the fascia separately to reach the lower part of the gland. Now, 2 extra points are that sometimes in 3% individuals, thyroid is also supplied by the lowest thyroid artery, that is thyroidea ima artery, which arises from the brachiocephalic trunk or directly from the arch of the aorta. And finally, the accessory thyroid arteries also supply the thyroid gland. Moving on to the venous drainage of the thyroid gland, the thyroid is drained by the superior thyroid vein, the middle thyroid vein and the inferior thyroid veins. The superior thyroid vein emerges at the upper pole and accompanies the superior thyroid artery, as you can see right here. It ends in the internal jugular vein right here. The middle thyroid vein is a short wide channel which emerges at the middle of the lobe and soon enters the internal jugular vein. The inferior thyroid vein that you see right here emerges at the lower border of the isthmus. They form a plexus in front of the trachea and drain into the left brachiocephalic vein, as you see right here. Now, concising the important points under the venous drainage, the thyroid is drained by superior, middle and inferior thyroid veins. The superior thyroid vein emerges at the upper pole and accompanies the superior thyroid artery. It ends in the internal jugular vein. The middle thyroid vein is a short, wide channel which emerges at the middle of the lobe and soon enters the internal jugular vein. The inferior thyroid vein emerges at the lower border of the isthmus. They form a plexus in front of the trachea and drain into the left brachiocephalic vein. An extra point, that is a fourth vein, cocha, may emerge between the middle and inferior veins and drain into the internal jugular vein. Moving on to the lymphatic drainage of the thyroid gland, the lymph from the upper part of the gland reaches the upper deep cervical lymph nodes either directly or through the pre-laryngeal nodes, and lymph from the lower part of the gland drains into the lower deep cervical lymph nodes that you see right here, directly and also through the pretracheal and paratracheal nodes. Concising the important points, lymph from the upper part of the gland reaches the upper deep cervical lymph nodes either directly or through the pre-laryngeal nodes, and lymph from the lower part of the gland drains into the lower deep cervical lymph nodes directly and also through the pretracheal and paratracheal nodes. Moving on to the nerve supply, the nerves are derived mainly from the middle cervical ganglion and partly from the superior and inferior cervical ganglia. These are vasoconstrictors. Nextly, looking at the histology of the thyroid gland is made up of 2 types of secretory cells. First is the follicular cells and second is the parafollicular cells. The follicular cells are the ones lining the follicles of the gland and secrete triiodothyronin and tetraiodothyronin, that is thyroxine, which stimulates the basal metabolic rate and somatic and psychic growth of the individual. Whereas the parafollicular cells are fewer and light cells. These lie in between the follicles. They secrete thyrocalcitonin, which promotes the deposition of calcium salts in the skeletal and other tissues and tends to produce hypocalcemia. This is a diagram representing the histology of the thyroid gland. Finally, looking at the clinical anatomy of the thyroid gland, any swelling of the thyroid should be palpated from behind. The swelling is known as goiter. Removal of the thyroid, that is thyroidectomy, with true capsule may be necessary in hyperthyroidism. During thyroidectomy, superior thyroid artery is ligated near the gland to save the external laryngeal nerve. Hypothyroidism causes cretinism in infants and myxedema in adults. I hope you found this video helpful. To get the notes on thyroid gland as well as notes on other topics of anatomy, physiology, biomechanics, psychology and pathology, visit my Instagram page, the link to which is given in the description below. To get updates on my latest videos, click on the subscribe button. To get notifications, tap on the bell icon. Thank you for watching.